Welcome back, everybody. This is the not the fifth. I was going to say fifth. This is an 8th week of you as a medicine, and today this is the second part of the structural integrity. We'll go over the shoulders and the neck, look at the main muscles that we are going to go through, look at some compensation patterns like forward head, rounded shoulders, hunchback, including the muscles and how the muscles actually demonstrate a common pattern. And we will look at some basic points, how to align the head, what to do with your head. And I will introduce some parts, which will include relaxation and also the activation of the parts that are not 100% active. And just looking back of our 8 weeks, the first weeks and the 5th week was about cultivating the witness consciousness. And then after that, this is basically creating a safe room for you to observe what's going on. Do you guys see the logic? Do you guys see the technology here? And after you create that safe room to observe yourself, the next step is learning from the observations, learning from your own investigation in a compassionate and non-judgmental manner. Because now you are stable enough, you are curious enough to see something and not immediately judge it, but be ready to learn from it. And then the third weeks of this psychosomatic part, at least, is the stretching the comfort zone, which actually is the fact that us human beings, we are always by instinct and by design, we are willing to improve. But then if this improvement that we are focusing on is like a rat wheel, and then we don't even know what we are running after, and then we don't even know what we are trying to do within our life, then it just doesn't get anywhere. And then we just see our fears, and then we see our discomfort, but we feel paralyzed, but not doing anything else but continuing the same pattern that's not serving us anymore. So the 3rd weeks or the 7th week, it's all about witnessing what is there and also pushing beyond that. That's why we used the compassion for these 3rd weeks in a way that actually you can see yourself, learn from yourself, and go beyond yourself, leaving all the positive and the negative connotations. And the 4th week or the 8th week are all about structural integrity, how to stand, how to walk, how to make the best of your own body for the given time. But what are you guys scared of? That is the question. Looking back at the last week, I want you guys to take a moment to really think of the things, what fear is for you. What is fear? And then most likely I will stop calling these fears and then start to readjust this in a way, because even the name fear is fearsome. I noticed that with the viewers and with the online takers, it is not a pleasurable subject. So let's work around it and then leave everything that you know off of it. But notice, what is fear for you? Is it discipline? Is it fuel? Is it freak out situation? Just whatever it is, or even the subject of you talking to people or journaling about yourself might be to be scared of. But I'll give you guys 2 minutes to match with your partners online and then discuss what happens when you accept fear. And for those of you joining on the video, pause the video and give yourself 2 minutes to share and reflect. Now, after you have read your own reflections, go back to the slides, sharing the screen right here. So we have a little practice to begin with here, because before I give you all the, honestly, this is not all the grids. The shoulder joint and the muscles and the tendons around it is such a complicated muscle group, and it does just so much. But I'll just give you some tips so you can start to think about it within your daily life. We are not going to be the experts on what muscle does what thing, any of that stuff, but we will have a solid idea in terms of how compensation feels, how it looks, and then how to become aware of it and relax what we need to relax and engage what we need to engage more. So as we are beginning, imagine you just sit up straight, and then we'll come to a seated position with your spine straight. And I put some numbers on the back of this beautiful man. And we are just going to move the shoulder in these directions. It's going to be as simple as like keep your arms relaxed, keep your neck relaxed, keep your torso a little bit more engaged so your spine stays straight. And then bring your shoulder blade to the number 1 position on your right arm, just the right arm. Lift it to 1, bring it to 6, bring it to 5, and bring it to 4. So it's like on a lateral plane, it's like making a half circle. So from the 4, bring it back to 5, back to 6, and back to 1. We will just do this a few more, like 3 more times. So slowly, like you're moving in a pool, very gently start to move your shoulder blade to number 6, to number 5, to number 4, and then from that point on back up to the 5, shoulder blade towards the 6, and towards 1. And in doing so, we are not exploring an edge. You can keep the motions very, very little. Just notice that you are moving your shoulder in the slightest manner in these directions. Let's do it 2 more. Bring your shoulder to number 1, and then slide it down to 6. Bring it down to 5. Push it down to 4. And also notice how your chest engages when you do this. Bring it back to 5. Bring it up to 6. And bring it all the way up to 1. Okay, relax the right shoulder, and let's do it on the left side. And on the left side, the numbers are still the same, so we will go 1, 2, 3, 4 in that manner. Just copy and paste the same thing over on the left side in your mind. So bring your shoulder to number 1, and then number 2, number 3, and slide it down to number 4. And then rolling it back up towards the spine, number 4 at the bottom, number 3 towards the spine, number 2, and then pull it all the way to number 1. Just doing the same thing on the left side. So keep the shoulder on the 1, bring it to 2, bring it to 3, and all the way down to 4. Again, pulling the shoulder blade back towards the spine, bring it back to 3, bring it up to 2, bring it up to 1. Same rotation, the shoulder blade coming towards the body. Let's do it 1 more time. Bring it to 1, drive it towards the 2, bring it down to 3, and then all the way down to 4, and then bring it back up, 3, up to 2, and pull it to 1. Very nice. Now you have to bring your right arm up like this, like you are telling a stop sign to somebody. So arm just up like that. And we will do the same thing on the right arm. So bring the arm up. And then now we are going to do full circle, external going. So bring it up to 1. Reach your shoulder blade forward like you are reaching for the 2. Push it all the way down to 3. Shoulder blade retracts back, bring it all the way down to 4. And then push it in 5. Pull it up 6. And push it up to 1. Continue to 2, 3. Pull it all the way down and back to 4. Pull it into the spine 5. Up towards the neck 6. And up towards the ear 1. Just keep it the same way, rotating it, pulling it down to 2, pushing it down to 3, retract it all the way back to 4, pulling it 5, in and up 6, and pushing it all the way back to 1. All right, let's do it on the same side. On the left side, bringing the up arm like that, and then lift it up to 1, bring it forward to 6, bring it down to 5, pull it back to 4, pull it in towards the spine to 3, up towards the neck 2, and up towards the ear 1. Same thing, it's like a forward rotation, like you are making a cycle. Push it out to 6, down to 5, back and down to 4, in towards the spine 3, and up towards the neck 2, up towards the ear 1. One more rotation, pushing out to 6, pulling down to 5, pushing down to 4, pushing into 3, pushing up to 2, and back to the ear 1. Now bring your both arms down, and then let's just do it. Keep your neck relaxed, and then imagine these both sides on both sides. So lift your both shoulders on the one position, bring it down to 6, which is 2 on the other side. Just keep your arms relaxed. Push it down to 5, push it down to 4, and then just keep rotating the shoulders in this manner in a very nice, very slow motion. Not really exploring the edge, but simply rotating the shoulders backwards. Keep your neck relaxed, soften the jaw, up, back, down, front, and now reverse the rotation, rotate it the other way. Just becoming aware of what you feel on the shoulders, but at the same time, what maybe feels dull or unavailable, or there is not enough many sensations. Just bring your awareness all around the shoulders and the neck. Very nice. Relax your shoulders, relax the head. Now that you have start to feel a little bit warmed up around the neck, maybe it will be more available for you to feel the next images. Again, these are not the main muscles, but the main muscles that I'm going to cover today. The first one is the pack. And then this pack is, as I'm going to mention, right on the superficial layer of your body. And it adducts your arm and makes you do push-ups, and also makes your spine go really hunched forward when it's tight or short. The second one will be pectoralis minor, which is this one. Immediately underneath the pack here, it connects down to the ribs and up to the top of the shoulder. And this muscle is almost always, not almost always, but for most people, it is a very muscle that holds a lot of stress, just like the upper traps that I'm going to say. And the next one is the serratus anterior. This one, unlike these two, is the muscle that is more underactive. So this muscle you don't even most people feel or see, which is underneath your scapula and coming to the and connecting to the sides of your rib cage, which does that 2 and 3 motion, which pushes your arm forward. And then from here we have that I'm going to mention. I'm going to mention all of this, but keeping it a bit more short. We have a limited amount of time. So this is the trapezius. The upper traps, they always work, and then you see people's shoulder lifted like this basic, this basic stress response. Like if you remember, we were mentioning the psoas as holding up the emotions, and this is the holding up the stress and fear and all that stuff. This is basically what you do when you try to protect yourself. So those are the upper traps and the pec minor. And on top of that, we have the middle part of the traps and the lower part of the traps, which are very functional. But again, for most people, just imagine if you're hunching forward, these guys are overstretching and becoming less efficient for the structure of your ribs and the spine. So these two are the rotator cuffs, but the part of the rotator cuffs that rotates the shoulder externally. So it brings your, when your arm is bent, it brings your hand out. And the name of them are, one is the infraspinatus, the other one is teres minor. Not going to pay too much attention to the names. And the other two is the supraspinatus and the teres major. These are the ones that rotates the shoulder internally, and especially this one that comes from the back of the shoulder blade on the top and then rotates all the way and connects to the front of the humerus bone, which is the main muscle when you experience the shoulder impingement. And it's a very painful thing to go through. What else that I have to say here? This muscle that lifts up your scapula. And from these ones, we can also look at some of the neck muscles that we will mention later today. First, if your head goes back, or if you are putting your neck in a backward bending position, that's called the extension. And if you're tucking the chin in or leaning the head forward, that's called the flexation. And then basically I'll say extensors and the flexors when we are talking about the muscles around the neck. Let's start with the shoulder. So the shoulder is such a small and intricate piece of mesh, has such a intricate piece of machinery that it has a lot of redundancy. So what it happens is, if we look at the back picture, you can lift your arm through the middle traps and the lower traps and the serratus anterior that is underneath the arm, or at the same time you can lift your arm with your upper traps, with your supraspinatus, top part of your rotator cuff, and using your pec minor on the front of the body. So there is always two ways of support. One is basically pushing, the other is pulling from the point of muscles, and they are all interconnected to each other. They are all, what they are doing is they are evening out the forces, so the muscle and the motion can be carried out in a stable way. And like looking at the joint itself, just like the hip bone, it is a bone. The top of the head, the top of the bone head is actually a ball, and it goes into the socket just like the hip. But the difference between hip and the shoulder is the socket is bigger, and on terms of surface area, it covers more of the top of the head bone in the hip than the shoulder. So the socket is smaller on the shoulder joint than the head of the bone, which means it is more functional and it's more for mobility. But when it comes to the hips, if the socket is bigger than the ball, it is a little bit more stability. So this is mean that we have these shoulders for a little bit more mobile range of motion. And of course, there is some nerves running through the shoulder girdle, which I'm going to mention shortly here, is the median nerve. Median nerve is the nerve that originates from these guys, C5 to T1. I don't think the T1, probably C3 to C5. And it goes all the way through the shoulder, down to the forearm, and to the four fingers, all the fingers but for the pinky. And they all go through the carpal tunnel. So the carpal tunnel syndrome is actually this nerve being impinged at your carpal tunnel. And when you have shoulder impingement or any shoulder injury or problem, then this pain might radiate all through your arm, just like from the lower part of the body. It's just like the pain of sciatic nerve can be felt at the hip, at the leg, at the knee, or elsewhere. Moving along, we will also shortly mention the neck pain. And commonly, the general reasons, I just Googled it. What is the reasons, general reasons for neck pain? And these are the answers. So the first and the foremost, the generation over wear and tear. So the first cause of why our neck hurt is because of us. Because the way we stand, because the way we sit, and it says bad sleeping position, the way we put our head or not. And this actually basically, it's either an acute injury or, but for the injury, all of these things that have been mentioned here are basic lifestyle adjustments. If you had an accident, maybe you also have to do some lifestyle adjustments depending on the accident. But the rest, but for the injuries, acute injuries, it is all something that we can actively take part and do something within our daily life. Degeneration or wear and tear, bad sleeping, compression of the nerve. This is not something that's going to happen overnight. It is something that is being repeated over and over and over again. Stress and anxiety is the same way. Why does it feel so good when somebody massages your shoulders? The first part that they are touching is the upper traps, where you hold all the tension. Whiplash, sudden jolt to the neck, they are all acute stuff that happens on an event, but the rest, it's not one event, it's a lifestyle issue. And then quickly, before we go through the shapes of how these things look, if you remember the names of the muscles, the generally tight part of the muscles are the upper traps, the pec muscles, especially the pec minor or the chest muscles, the rotator cuffs, when they are doing the internal rotation, and the anterior deltoids, which is the front of the shoulder, right in front. So as the deltoid has three parts, is the right in front, the biceps or the brachialis that is underneath the bicep, and the neck extender, so the stuff that lifts your head back. Actually, that as we talk about the correct position for the head, rather than like, because everybody says you have to do back bends to fix any spinal issue, and here the neck extenders are short and tight, it's because we completely slouch our head in a way. 1 second, everybody. Slouch our head in a way that keeps the extenders short, but at the same time, the neck flexors, the ones that tuck the chin in, really unused or underused. So on the other side, which are underactive or too stretched or not functioning properly, are going to be on the flip side of the upper traps, the mid and the lower traps. Those are the main stabilizers for the shoulder blades, and for the thoracic back, the middle back, and they are generally not too available for us to use. The serratus anterior, they look like butterfly wings on the on the side of the rib cage. Did I actually put another picture of the serratus here? No, I didn't, but this is the best picture I have. You can also do some just Google imaging at the end and see how this muscle looks and feels for you. So going back to this, the rhomboids. Okay, rhomboids are these guys. So they actually pull your shoulder blades in. That is the position when we go into 5 and 6. This is the little part and this is the big part of the rhomboid. So that actually gives another stability for your shoulder. And if you can actually see from the part of the shoulder, the only part that the shoulder is connecting to the body through a bone is the collarbone. The rest of the shoulder is stabilized with nothing but muscles and tendons. So that's why it's also so easy to dislocate your shoulder, this and that, because there's no other bone that is supporting the shoulder but for the collarbone. Okay, moving along, moving along. So at the same time, just like the rhomboids that are not stabilizing the shoulders, we also have the rotator cuffs, which are externally rotating the shoulders. They are not functioning as much because they are being overtaken. And in this compensation pattern, the triceps, which are actually from your fascia tissue, they are also functioning in the same pattern with your serratus anterior. So that stabilizes your shoulder in this way. That's actually why I have this. So imagine this is your, just maybe not imagine this is your arm, but just look at the mechanics of how we can support one weight. So this is a pole and this is a pole and then there is a weight here. So in order to support this weight, you can go over the top of the support point and then create pulling. So if my arm is straight, the muscles on the top or around, they can pull to lift the arm up. This will work. But at the same time, we do this so much that our shoulders are lifted, we forget to use that we actually have a push system for the same support mechanism. So this is pulling on the muscle to lift it up, but this is actually you using the muscles to push. So here, if this was actually the arm, let me show it quickly on my video. So the upper traps are here. So they are the same thing. They are taking the weight from here and lifting the arm up. But at the same time, if I am using the under guy, so I'm locking my tricep, the tricep is going down to serratus anterior, and this one, the shoulder blade, the scapula, I'm pushing it forward. So I'm still keeping the arm up, but one is like this being carried with the supportive muscles, and the other one is being pushed by the actually big muscles that are supposed to carry weight, rather than doing small stabilizations. So this is why I made this beautiful diagram of the mechanics of the body weight. And if I didn't even bring all the acute injuries or the general problems with the neck and the shoulder, but I'm just going to bring some common compensation patterns of the shoulder and the neck that is solely, almost only are depending on how we carry ourselves. Rounded shoulders. This is, and most of these are developing because of also the emotional body and the life and the experience and how you try to experience life and digest life and make sense of your own experience. So elevated shoulders, the shoulders being lifted. Shoulder impingement. What happens after so much rounded shoulders, so much time on the computer and the mobile phone? The shoulder blade, the scapula, actually starts to impinge the the top part of the rotator cuff. And then you might have to get a surgery or do corrective therapy. But at the same time, there's the wing scapula. There's some of the muscles of the scapula are not working, which are the bottom ones, let's say middle trap, lower trap, rhomboids, and the serratus to push the shoulder blade in. And the top guys, the upper traps and the pec minor, they are all so strong that the shoulder blade actually moves away from the body. This is the easy sign to see whether somebody is using their core muscles or not on the top part of their body, if they lean against a wall and the shoulder blades are winging. And there's still more. There's the forward head pose when you lean the body forward. And this is again something that we are actively doing in our lives, that we actually do have a say to fix it. This, symptom or the cause is the excessive kyphosis, which is the hunchback or the there's also technique. That's a new term that I learned today. That is the big bulge on the neck when the head goes too far forward, and people come and ask me, they're like, what am I going to do with that bone? I'm like, stop sticking it out, because every time you're on the computer, every time you are on the phone, it just drops down to the lower level, and then obviously for all the right reasons, it's gonna start to put some excessive weight on the thoracic spine or the ribcage spine that is not meant to carry it. So maybe uneven shoulders is one of the ones that is not 100% lifestyle related, because if you have, let's say, scoliosis, that will also end up in uneven hips and the shoulders and all that stuff. But we do, like if you carry your bag on one side and then work one arm more than the other, your shoulders are also going to get uneven. And unevenness within the body is very common, by the way. And also the upper cross syndrome, in which your head falls way forward, and then basically it's all the combination of the rest of the things that I mentioned. So here is like a normal human head, average human head, let's say, weighs about 12 pounds. And when it leans forward about 1 inch, it doubles the weight. So every inch, it's supposed to double the weight. So I don't really know the calculations that they did in this illustration, but it drastically increases the way your head weights. And then when your head starts to weight, so these are the neck flexors. See from here how they are tall and then supportive and even pushing the head back, pulling the chin back. Now they are all short and then everything is falling forward. But on the flip side, these guys, the front of the neck muscle, which carries the head upright, they are getting completely into a short and unsupporting position. But what to do when to change the pose, it's maybe, I don't know, maybe this guy is just too perfect for the picture. But what you need to do is create some basic engagement in the middle of your back, which is on the front side, it is the serratus anterior and the lower and middle traps, and also the rhomboids. You have to start engaging. The bottom of the shoulder blades, you have to wing or you have to pull them in. And then that's going to open up the front of the chest, and it's going to open up the pecs and the chest and the sternum. So you will even change the shape of your rib cage. And then keeping the ear immediately in the middle or to the front part of your shoulder. So the ear over the shoulders, the head in a neck in a straight position. And when most people try to stand up tall, they lift their chin up too. But rather than lifting the chin up, you are tucking the chin in, so the neck, the extenders get longer, and then the chin comes back to its own space. Sometimes I even push my jaw forward to push the mid back forward if your lower teeth are a little bit more back than immediately under the teeth. So what to do? These are some, because most of these poses are actually poses that you have to do and stay in it. I'm not going to engage these poses in the later practice, but I really want you to make a habit of doing these. These are super simple, and the best pose. You can do this on the floor, you can do this against a wall. Simply not the top or the bottom of the head, but just the back of the head towards the wall and lightly push. It's not like you are digging against the wall. And then the elbows and the back of the hands. What you can do here is you can roll even your hands out. So put the thumb to the wall, put the pinky to the wall. Really slight rotations that you can feel that your shoulder girder is moving. And all this time you are going to push the shoulder blades down. And for this guy that's doing the wall plank, he's doing it perfectly. So there's no kyphosis here. He is not hunching. And if I can show it like this. So imagine there is a wall here. If I can go. Imagine there is a wall here. Okay, right there. So most people go like this. Push, 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 wait, wait, wait. And most of their plank is just looking like this. But what am I doing here? I'm engaging the same part of the problem that I'm trying to fix, but I'm actually enforcing the same pattern that I have been using. So rather than doing this, maybe you really lift the shoulder blades up, see where they go the highest, and then push them all the way down. So, okay, my shoulder blades are down. Now what do I do? I have to vectorially push these guys forward. Imagine this is where the serratus is. So you are going to push the elbows forward rather than keeping the head up or down like this. Keep the head in a straight position. Let me see. I think I look okay. So keep pushing the shoulder blades forward. In a manner they are also being pulled down. And this is also very good to create. This also stretches your pec minor and chest a little bit. And at the same time, it starts to engage the back part of the body, mid traps and the lower traps, as long as you keep your shoulders away from the ears. And some other poses that you can consider. And you can really get creative with this kind of stuff. And for me, I really find arms over the head. That's why I didn't put any pictures of arms over the head, but you can also do it. I find it too intense, so I generally put a pillow or a yoga block or a bolster or anything somewhere in the middle of the back. And if the head is going too far back, I also put something under the head or like a big bolster like this. Just in this case, trust your judgment to feel comfortable. But again, you want to do these poses for at least 3 minutes, starting from 3 minutes. So do not go for an excessive feeling. It feels so good, but I'm in so much pain. Let me get out in 5 seconds. Rather than that, just feel a little bit, but then feel it for a long time. Because we are not changing the muscle. We are not changing the joint or the tendon. We are actually trying to change the shape of the bones, and it's not going to happen overnight. But it does happen over a decade, as you can already know the shape of your shoulders and the spine and the head. And little quick tips how to use the headrest in the car, because we spend maybe a lot of time in the car. You can keep the headrest so this is actually for safety. You have to keep the headrest up in a way that your head is going to go directly on it, not whiplash back, or not like you are a Ferrari driver pushing it all the way forward, but keep it in a way that actually aligns your ears to the middle of your shoulders. And then you can lightly push against the headrest. So if this is the headrest and I'm pushing on it, what I'm doing is if I'm pushing the head here, it doesn't mean, excuse me. If I'm pushing the head here, it doesn't mean that I'm using the muscles here. What happens is you will get to see that these muscles are actually connecting all the way to the mid-back and the underneath the upper traps, and it's gonna try to activate the underactive muscles of the mid-back and the upper back that are not being utilized 100%. So this is how to put the head and then push against it. Or you can, just like that other lady here, you can push the head against the wall just to start to feel that thoracic engagement. And here, the same thing, using your mobile phone. I mean, even looking at you, some of you trying to see the screen, but the head is so far forward. So we have to start first and foremost, we have to become aware of it. And then little by little by little. First time it's going to be 2 seconds. You put the head back into the correct position. 2 minutes later to see that you are back into the same thing. But never giving up. Or never judging yourself. Just doing it over and over and over again until it is your second nature. So there's, I think with the how many pounds on how many degrees, it's just to make the point that the further it goes, the more it's gonna start pushing on the back muscles, and your head might fall. And I actually have a video that's 100%. Just follow the video here. That's going to 100% make sure that your serratus anterior is active and engaged. And here you go. You can try a practice like this, which I found very inspirational. Like you can see he's using his middle traps and the lower traps and pushing up. So if you feel like it, you can give it a shot. And that's how it might look when we actually start to engage. But at this point, at least my practice or my trying of that is going to look like this. But anyways, let's get rid of this and start today's practice. So I am actually going to practice with you today just to see how things go. Check. All right. So just lie on your back in a position that feels right for you, and then keep your spine straight. Keep your knees bent and touch your knees to each other. Tilt your pelvic back and forth a few times to make your spine, and not the spine, but the lower back, in a more comfortable and relaxed position. All right, so what we are going to do here is first imagine the picture of the serratus anterior and bring your hands into a fist position and push your hands against the thighs. Now in forward way and it's also downwards way, push against your thighs and then see what happens to shoulder blades. So I am pushing in two directions or one diagonal direction. I'm pushing it forward and I'm pushing it down. So it's being pushed down towards the heels, maybe forward and down, and see how it actually moves the shoulder blades. And there's so many practices that you can do, but most of, like even the planks that I'm not carrying out today is because when you do the plank, there is a greater possibility that you are going to use the pec minor and the upper traps. So this one really eliminates all of that, and you are just pushing it forward and down, and already the spine getting a little bit more straight on the floor. And within that position, simply keep pushing the fists forward, up, and as much as you can, pull it all the way back. Make sure your lower back does not lift off the floor. Keep the elbows locked, and then reach it all the way forward. Notice how the shoulder blades move, and also not do this. Keep your shoulders down away from the ears, pushing it all the way down, bring it down to this position. Maybe watch me one more time. I will do how not to do and how to do, and we will do this a few more times. So this is how not to do it. Lifting it up and then almost choking yourself, and arms bent and shoulders rounded forward. So really push the shoulder blades down and then push the arms down and forward. And then as the shoulder blades are as far down as possible, keep them all the way up. See the shoulders are still away from the ears, and then bring it all the way back down. So this is one way to make sure that the upper traps and the pec minor are not working, and the triceps and the serratus are actually working. So let's do this a few more times. Push it all the way down. Notice the shoulder blade on the floor throughout the entire practice. Shoulder blades never lifts off the floor. And I'm not bringing it all the way overhead because that's as far as I can go, but if you can move it all the way up, go ahead. And then pushing it up, forward, and then all the way down. Just do this a few more times. Let's do it 3 more times. Keep your shoulders engaged and keep your pelvic floor engaged here too. See how that feels. Pushing it up, elbows locked. Notice that reach and stretch, and then pushing it all the way down. You are moving slow, but you are moving very strong. So I engage the triceps and then keep the shoulder blades all the way down. Or something popped in my shoulder, that's a good sign. Push the arms forward, shoulders away from the ears, reaching it up, pushing it up still, thoracic spine getting stronger and straighter, and bring it all the way down. Move the shoulder blades on the floor at all times. Very nice. In the second one, you can keep your arms in a straight position and push your palms down. See this one, you can get the shoulders a little bit wider this time. Push the palms down, lower back flat on the floor, and then reaching the arms forward, imagining that outer edge as we were doing the circles, reaching it up. Again, the neck even getting straighter, but keep the shoulders relaxed away from the ears, and then sweeping it all the way down. You will also feel your core engaging because serratus is actually tying down immediately to your core muscles. Push your palms back against the thighs. Notice the shoulder blades push down again, chest open. Block out the triceps, reaching it up. These are all slow and corrective motions all the way up. And then reaching it back down. Notice the range of motion that your shoulder blades are moving right now. Very nice. One more time. Push against the thighs. Shoulders to put down, neck long. Core engage, pushing it all the way up. Pushing up and overhead, and then bringing it back down. If you are not using to move, if you are not used to moving with your serratus, this might actually feel like a foreign motion because the parts of your shoulders that you are normally using are not being utilized. And then the second one, this is the third one, this is the hardest one. So just bring your arms in a position that looks like a goalpost or like a cacti, and keep your elbows down, shoulders down, shoulder blades wide. Now in this position, just swoop them up all the way, keeping the shoulders down, shoulder blades away from the ears, and then bring it back to a goalpost position. You can also do this leaning against the wall. That also works perfectly. Maybe next time you watch this video, try it against the wall, reaching it all the way up, keeping the shoulder blades down, lower traps engaged, middle traps engaged, rhomboids pulling in, and then bringing it back down. Just moving it a few more times. Feel the engagement, but also feel how the tops of the shoulders are actually relaxed. Pushing the shoulder blades down, and then reaching the arms up, feeling the strength from the sides of the ribs, and then bringing it all the way back down. Let's do this two more times. Keep the backs of the hands on the floor too. Even your nails on the floor. Shoulders are not choking the throat. Push them wide and down. Arms straight, and arms coming back down. These feel very little motions, but very re-educating motions for your body to improve on. And eventually it will be a way, moving it one last time, it will be the way you normally move. Bring it all the way down. Very nice. For a moment, I want to show you one more thing. Just lie on your face this time, or you can do this against a wall. Just come real close to the wall. And this is one of my hardest things to do. So basically what you want to do is lift your hands up and then bring the hands down. Keep your elbows on the floor. This is actually how you are using the mm, rotator cuff that external rotates the arm. Keep the chin straight, elbows right. And if this is too hard, you can bring your elbows a bit more down. But it's not going to make much difference. Just leave your hands off the floor 1 inch or two. If you're comfortably doing this, that's good for you. Push the shoulders down, keep the hands up, and relax them down. Notice what happens. Push the shoulder blades in and down, and lift the hands up slightly. Notice where you feel the engagement, and then relax them back down. Very nice. One last time. Reach the hands all the way up, and then bring them back down. And here, in order to really engage the middle and the lower traps, the idea is to, rather than keeping the arms like one, so this is me using my upper traps and then lifting the shoulders back up. So basically, my shoulders are rounding forward and arms are being lifted, but not with the main muscles. So what I want to do is maybe lift the thumbs up in the beginning and lift using the middle and the lower traps. So it kind of changed the way you engage. So rather than shoulders rounding forward and up, you want to externally rotate the shoulders and pull your shoulder blades towards each other. So when you round them, what happens is the bottom parts of the shoulder blades are getting wider, but what you want is them to get closer so you can engage more of your mid back. And then most of the time, most people looks too far up in this position. Rather than looking too far up, maybe drop the head in a level position and tuck the chin in, so the upper traps are not pushing on your neck. Rather than this neck kind of impinged position, you want to push the upper traps away from the way of the leg and keep the head not in a down or an up position, neutral position. And these are the basic things that you have to do within your daily life. You know what I mean, everybody? This is in a way that you are going to practice and practice and practice until you are 100% aware of what is going on and how do I feel. If you feel like your shoulders and upper traps are already tight, that really says something that you are using those to facilitate. And like, the problem here is not that you are not going to use your upper traps or the pec minor. They are there for a reason. But if I'm lifting my arm up, then they should be supporting the motion, not initiating the motion. It's the same thing with the lower back. So if I want to lean and grab something from the floor, it's okay if I like, I don't have to go down like a log and then take it just not to use my lower back. But what I want to do is maybe even if I'm going to slightly bend from my lower back, I want to initiate the pose with my hips. So if I'm leaning, the way back up is not this, but the way back up is using the hips and then pushing from the bottom of the hips. And on the way, your lower back will help. So it's the same thing with the arm. I can lift the arm like this, no problem. That is upper trap and the pec minor. But then what you want to do is you want to push it up, and then the little muscles, they will do their job stabilizing it. So let's quickly go back to the slides. And are we looking ahead? So I was originally planning on this as an 8-week program, but looking at it now, it kind of lacks the connection between the hips and the shoulders, which is the core, which I have some more stuff to say about actually how to walk and how to stand with the thoracic spine and how to engage the diaphragm. Because one thing that I did not mention with all the shoulder and the neck problems is they are all very tightly closed with the shallow breathing. Shallow breathing means when you are using the auxiliary muscles of the neck and the upper traps and the pec minor to pull the air in, pull the air in, pull the air in. But rather than that, you want to really create it like, do I have a bottle? I do not have a bottle. But imagine my entire body is like a cave or like a well, and at the bottom, there is like a trampoline. So rather than stuffing the air here with this, if I stretch this trampoline or pull this trampoline down, then what happens is it automatically vacuums the air back from the top, which is the nostrils. So rather than actively pushing the air in, this is what is called the vacuum effect. So you pull this muscle down, and or like if you put a balloon at the bottom of a bottle and then cut the bottom of it, if you push the balloon, then the air will rush in from the top of it. So maybe it will be very helpful to add one more structural integrity session, adding and talking about the core and the trunk and the torso. And I am also, just like I mentioned before, maybe do a session in terms of how to actually restructure the way we view ourselves. And this is going to dive into all the essence of you facing and managing yourself. But more talk about that later on. But I am telling you that next week we will do the part on core as week 9. And What to do self-practice? First of all, go back to the pictures and do the wall planks, side planks, and also leaning against the wall, start on the wall, any of that, any plane that is giving you a sense of direction that you can lean against will actually realign and reshape how you engage with your spine. And some questions that you need to be maybe asking yourself is like, are my shoulders relaxed? Relax them again. Am I engaging with my mid back, or am I just collapsing on the front of the sternum? What is the position of my spine? Am I aligned? Am I distributing the body weight, or am I just leaning on one part of the body? And you can ask, is my head aligned? I mean, you can ask it physically, mentally, emotionally. Anyway, just keep checking in with yourself, keep loving yourself, and keep learning from yourself, because we all have a limited time. And in the meantime, it's very nice to make the best of your own resources, your breath being the first and the foremost of them. So let's take one more moment to journal, everybody. Pick up your pen and paper. And for those of you coming online, we will go back to the group so you can finalize your conversations. And the idea is that why it is so hard to help your own self. I really want to start thinking about it, because I can see in your own eyes, and everybody can relate to it somehow. It's very easy. It's the easiest thing to solve somebody else's problem. But why is it such that we can't have the same age-old advices that we have for our best friends for ourselves? So I'll give you about 2 minutes, and for those of you joining from online, just start to think to yourself and notice why your advice for other people might not be thought of, not even apply, might not even be thought of in a situation that you're experiencing within yourself. Recreate. It's the same partners. And for those of you joining on the recording, your 2 minutes starting now. So maybe we will add a bonus week to all these, and adding maybe a core part, and I will mention this later. And furthermore, really creating your own sense of self that I will try to cover up. 1 hour is not merely enough time to give the enlightenment of your own life, but I will give you guys some real cues as to how to reinvent and recreate your own self-image. That might be the bonus week. So thank you so much for joining, everybody. I can't wait to see you next week, talking about our core and the main connecting between the shoulders and the hips.